sometimes it's honestly shocking to me what my patients get like mad at me for. So sometimes they'll even be, annoyed. And let's just picture this, right? You come to me with a goal of weight loss. You're like, Laura, my goal is I want to lose 30 pounds. Or you're like, I cannot lower my inflammation. I'm also super constipated, right? And so my job, in what I always tell patients, is to make a recommendation for you, okay? My job is to make the best recommendation, the one that I know that is going to give you results. The goals that you came in with, I want you to achieve those goals. And if I feel like genuinely you can't achieve those goals that you've set out, I will also tell you that. But it's always surprising to me when I make a recommendation, usually it's a test or a procedure that someone doesn't like, and they're annoyed by it, genuinely annoyed by it. Let's talk about a couple examples. First would be, and most notably, if you've ever seen me as a patient, is the insulin glucose challenge. So the insulin glucose challenge is a really phenomenal way that we can actually look at your metabolic functioning from a really deep level. This allows us to see, we're not answering the question, do you have diabetes? Because most often you don't. But what we're doing is we're actually asking the question, not does your body store sugar, but at what cost? How hard does your body work when you consume carbohydrates to actually store that? And so this test allows us to see that aspect. It allows us to identify, issues that start far before diabetes, right? That stubborn weight gain, that low energy, that trouble sleeping, those hot flashes and night sweats that still are not fixed, even though you're on hormone replacement therapy, those cravings, right? And so looking at this helps us understand your metabolic profile. It also helps us determine, what diet would be best for you. Should you intermittent fast? Because, everybody's read, you should intermittent fast, or should you go low carb, or should you be, eating every 3 hours? Or should you be having 3 meals, no snacks, and eating, very spaced out? We see all of these diets online, and patients come to me and they're like, Laura, which diet is best for me? Well, this is how we tell. This is how we know. And ultimately, when we are looking at changing your diet, we're using that as a tool. So if I tell you your results are showing us that you should be doing intermittent fasting, and here's what that looks like, that doesn't mean that for the rest of your life, you will be an intermittent fasting person. You're going to be the person that intermittent fasts. Ultimately, we're using that intermittent fasting as the tool to move the needle, as a tool to get you to, start to get rid of those cravings, improve your energy, improve your fatigue, improve your sleep. Just basically take the pressure off so that your body can recalibrate and resensitize to insulin like it's supposed to. And I always tell a patient, we're going to start with diet A, whether that's intermittent fasting, whether that's 3 structured meals, no snacks, whatever that looks like. We're starting with, diet A or strategy A, and we're going to move that as we see progress. So what that means is that you're probably going to have to do the insulin glucose challenge again. Why do people hate it? Because it's not fun. You have to be at the lab fasted, you have to be there for 2 hours, and you have to drink the nasty glucose drink. But what I will say is as people improve metabolically, the test feels less awful. And so that can be part of your indication as to how you're doing, right? If it's awful and you feel horrible, then you're probably not doing so hot. And then also that allows us to really switch our strategy instead of just guessing, right? Do you still need to be on berberine or chromium or inositol or any sort of supplement tool that we've used, that we've deployed to help with your blood sugar? If you no longer have blood sugar issues, we no longer need to use that tool. And so it's also really important from a treatment perspective to not use unnecessary treatment, right? We shouldn't be taking the same supplements for years and years and years. We should be adjusting and we should be moving and we should be updating based on updated information. And without that updated information, I don't know what's happening next, right? And so the good news is I tell my patients, if you do this test and it's perfect, we never have to do it again. But if you do it with the symptoms you're presenting with and it's not perfect, I would like to see it again. And so I'm not doing this to torture you. I'm doing this because having that data and having that insight is how I make really clinically informed decisions about your plan. I don't want to do that blindfolded. I don't want to do that without data. Another example is the bowel clear out. If you've ever seen me and you have constipation, you probably know about the bowel clear out. It is basically similar to what you would do for colonoscopy prep. Now, why do we do a bowel clear out? Well, we do this because if you really picture it, first of all, most people are constipated. That's just a fact I'm going to lay on the table. Because at the end of the day, we should be having a full, complete bowel movement every single day. And if we do not, there is a problem. You should feel fully evacuated, and you shouldn't be having to strain for that fully evacuated bowel movement. If you go every other day and that's normal for you, it's not normal. It might just be your norm, what you're used to, but that doesn't mean it's normal, right? So one of the tools I might deploy here is called a bowel clear out. This is where essentially, for lack of a better term, if you picture the colon like a tube, if we have poop that's stuck along the side and we think about the microbiome, we think about the bugs in the gut, really we're full of bugs. Now we have bugs in our gut. And a lot of times, in a lot of cases, we have dysbiosis. We have an imbalance in those good and bad bugs. Why? Number of reasons. Infections, aging, hormone changes, food poisoning, right? Like anything can really cause that. Childbirth, pregnancy will shift your microbiome. And so we have to go in and change that microbiome. There's a lot of herbal interventions we can use. But if we do not clear out the poop, there is a real chance that we actually don't get resolution to your symptoms. There is a real chance that when we go in with that antimicrobial strategy to try to reset the bugs or treat the dysbiosis or get rid of the SIBO or the H. pylori or the parasites or whatever we think it is, there's a real possibility that some of that is hiding, for lack of a better term, behind the poop that we didn't evacuate. And so again, if I recommend a bowel clear out to you, it doesn't mean that you have to do it. In fact, you actually don't have to do anything I say. But I will always be honest with what I think the best next step is, the best recommendation for you to get the best outcome, because that is my job, right? And if I were to make recommendations by what I assumed you did or didn't want to do and not based on clinical data, I would not be doing my job properly. I see this also when I recommend a stool test like the GI map, and I will often bring it up in a setting with a patient where I will say, listen, I think this test is the next best step. Maybe because they've got a lot going on digestively. Maybe because we've been, circling back and circling back and circling back to their digestive plan that so far has not given us any sort of outcome that we're looking for. And I say, listen, back to the test we spoke about. The patient will say, well, that's too expensive. Okay, no problem. We do not have to do it. But my job is to tell you what I think the next best step is so that we can get the best outcome, right? And so just because you might not like the recommendation doesn't mean it's not the best one. And I also want to be clear, my goals are your goals, right? As my patient, I want you to do well. I want you to get better. If you're struggling with stubborn weight and you're struggling with anxiety and hot flashes and fatigue and painful periods and spotting between cycles and headaches and you're like, my mood is off. I just want answers. And I'm here to say, this is the testing, or these are the investigations, or these are the procedures that we need to be doing in order to get those answers. And if you don't want to do those things, that's okay. But then we just need to be realigned with our goals, right? So if you are saying, Laura, I'm not doing the insulin glucose challenge, no problem. But if we don't get results, I don't know where else to go. So we can try these strategies. We can start to implement some things that I know from clinical experience to be true or to be helpful. But as long as we're on the same page with knowing that that is the missing piece, that's okay with me, right? Some patients will approach it as if like they're going to get in trouble, like, I don't really, or, they'll put off the bowel clear out for a year. And I'm like, well, we could have done something else. You didn't have to stay constipated for a year, right? And so we just have to have these discussions and be aligned. There's always going to be the treatment plan, and then there's going to be what you can do and how you can implement things in your personal life, because I'm not in your life, right? I'm here to just say, based on what's going on, here's my clinical recommendations of the next step. And then it's your job to say, you know what? I can do X, Y, but I cannot do Z. And then we have to workshop what's the next best step, right? If you really don't want to do the test, if doing the test feels like the worst thing you could possibly do, then let's figure out what else we can do. How else can we workshop this plan for the next best results, right? When it comes to weight loss, they're like, I cannot lose weight. I'm like, great. Let's look at what you're eating. I have to see what you're eating. Like, I don't want to track food. It's too overwhelming. Great, no problem. But we cannot have the expectation that we're going to lose 20 pounds if you're not willing to show me what you're eating so that I can modify that, so I can give suggestions, so I can change that. We can change our goals. That's totally okay. You do not have to track if that doesn't feel aligned with you, if that feels overwhelming, right? But I don't want your expectation to be that you're going to lose 20 pounds by just making sure you have enough protein and looking at nothing else when I haven't got a baseline of what you're even eating, right? So as long as we're clear with our goals and our expectations and how changing the plan changes the outcome, or how doing something and not doing something and choosing another avenue changes the outcome, that's completely okay. At the end of the day, it is your health journey. You just have to decide where you want to go with this. And I'm often having this discussion with patients. They'll say, here's my goals. They'll give me 7 goals, and one of those goals will be to lose weight. And I'm thinking, okay, there's lots of other goals. It's not just weight loss. So I say, how badly do you want to lose weight? Like right now? Or can this be a later discussion? Because I definitely don't want to say, yep, no problem. Here's your goals. Here's the plan. They come back in 4 weeks. They're like, I haven't lost a pound. And my treatment plan had nothing to do with weight loss. But we have to make sure we communicate that so the patient knows that my expectation is not that they lose weight or, what textbook weight loss looks like over the next, 4 weeks or over the next 8 weeks or over the next 3 months. You can set the goalpost wherever you like. It is your health journey. And so just a reminder that you can do whatever you like, however you like, at your own pace. There's nobody waiting for you at the finish line. But it's really important that you have those conversations with whoever's helping you get there so that you guys can have honest and informed talks about what's going to work, what's not, why they've chosen a strategy, and why they might have chosen something else.